Ira had a condition called Placenta Percreta. So the placenta in normal situation will be situated at the upper part of the womb, and it's just attached to the inner wall of the womb. Ira's case, what happened is the placenta was situated low. It was covering the cervix or the neck of the womb. So this is called placenta previa. It is low. So in this kind of situation, the baby cannot be delivered normally because the placenta is basically blocking the exit. In addition to that, the more complicated in Ira's case was that this placenta not only attached to the inner part of the womb, but the placenta has invaded or encroached or passed through the muscle layer of the womb up to the outer part, invading to the serosal layer or the outer part of the womb. So this is called as Percreta. So after discussion during our MDT meeting, we have decided to proceed with the triple P procedure as a conservation of the womb or uterus for Ira. A lot of teams and support from all levels. Basically, it was an amazing effort by everyone in the hospital for this patient.
We found out during the operation, the pelvic organs stuck together. We did the operation meticulously to reduce injury to pelvic organ. We have given the best care to the patient with the best outcome to our patient.
MRI can determine how extensive the involvement of the placenta into the uterine wall or even extension beyond, and to see if there's any involvement of the surrounding structures.
Once a baby has been delivered, we will inflate the balloon so that there's no more blood flow into the internal iliac arteries. In that sense, it will reduce the blood flow into the uterus so that you will minimize bleeding in this complex case of surgery.
The mother was first presented at I think a month before the delivery for bleeding, and there is the risk of prematurity in the baby because once the mother starts to bleed, we have to secure the bleeding and the baby has to come out lah. So fortunately, the mother was able, that means Puan Ira, she was able to carry on the pregnancy until at least like 34 weeks plus. So babies, her name is Valencia, so she was born on that day at 34 plus 4 days. Birth weight 2.295 kg, which is quite a good weight for a 34-weeker. And I was able to discharge her at day 8 of life. And she actually, because her weight is good and the gestation age was 34 plus 4 days, so it's actually not too bad for a prematurity baby.
On the day of surgery, Madam Ira called me at the early hour to tell that she needed treatment. She came to emergency department. We did the initial assessment and we sent the mom to OT for the next care that she needs to receive.
The minute I received the call from Sister Shamini that there is going to be an emergency cesarean section, we coordinated with all the departments, namely the allied health, consultants, the nurses, to ensure that mother and baby is well taken care during the surgery, and thereafter we transferred the mother to postnatal ward and baby was sent to nursery.
Okay. While Sister Annie team and Sister Shamani team looking after the mother, I and my team actually looking after the baby. Then to ensure the baby is actually receive a good care while the mother is being taken care by other team.
Saya selamat, bayi saya selamat, dan rahim saya pun bisa dipertahankan. Berterima kasih sekali sih dengan para dokter dan perawat yang sudah menjaga saya.